What we're going to do right now is we're going to check the movement of both sacroiliacs. We're going to see if the left sacroiliac has the same amount of movement as the right. And the way we accomplish that in the seated position is Aman's going to put his feet together and his knees together. I'm going to place my fingers right just inside the sacroiliac joints, and I'm going to have him spread the left knee out, bring it in. Now we're going to do the right. If you notice, it's a very subtle difference. Bring your knee in, Aman. The left side, as he moves it outward, move your left knee, Aman. There is movement, but it's not as much as the right. Knees together, spread the right knee. There's a lot more movement on this right side. So right now, the conclusion is the right sacroiliac has more movement than the left. Thus, there's dysfunction and restriction on that side. Now what we're going to do is we're going to see if his hips are actually level, has one gone up, has the other gone down, and vice versa. And we're also going to check the movement in a different way. So now in this position, the patient is standing. Now we can see what the entire structure is doing as he bears weight. Left sacroiliac and the right is right there. We want to make sure that we're on the same points. So as you can tell, the left sacroiliac joint is sitting slightly lower than the right side. So this can mean two things. Either the left pelvis has dropped down and misaligned, or the right pelvis has gone superior. Now we know that this is moving properly, so this is not the problem. The problem is the left side. It's actually gone inferior. Now we're going to recheck to see if they're both moving or not. Okay, so Aman, you're going to raise your right knee towards your chest. Back down. Do it one more time. And the thumb drops down. That's actually a good sign. Good. Left side. The thumb doesn't even move. It stays put. Again. One more time. Okay. You can bring it down. So what's happening here is, again, we can reconfirm. Yes, there's movement on the right sacroiliac. No, there's not that much movement on the left side. And we can also look right next to these two dimples. There's some swelling in this whole sacral region. You got like a diamond-shaped region here. This is your last lumbar. This is your tailbone. There's some swelling there. So what we're going to do right now is we need to restore movement and function back into that joint, and then we're going to recheck him. This is the position that we're going to put the patient in to restore movement back into this joint that is not functioning properly, or what we call as dysfunction. Put the patient in sideline position. We're going to restore that movement there, and you'll see in a moment with the adjustment. Okay, so we just adjusted the left sacroiliac. Now what we're going to do is we're going to recheck it to see if the left sacroiliac joint is at the same level as the right, and if we were able to restore any movement. During the adjustment, we got a very small audible on the left side. Audibles sometimes mean things, sometimes they don't. What I'm more interested in is that there's movement being restored. So there's that left sacroiliac. There's that right. So now it appears that the left one is slightly higher than the right. That's actually not a bad thing. I'm happy that we're going to get to restore some balance into that area. Now let's check the movement. All right, I'm going to raise your right knee. Okay, that still moves inferior. Good. Left one. Yep, and that's definitely moving a lot more than before. Bring it down. Again. Excellent.